Total breast reconstruction is done immediately at the same time as the mastectomy. There are two main approaches. One, a flap procedure, or two, implant-based procedures. The first procedure, which is the flap procedures, involves harvesting fats or tissues from other parts of your body that you do not need, what we term as spare tissues, to recreate a new breast and have that transferred to the defect that is left behind by the mastectomy. The main advantage of flap procedures is the fact that it offers the most natural appearing breast that will match your other breast. The main disadvantage is that it involves a separate cut in another part of your body, and therefore you have to deal with two wounds healing. The second approach is that of an implant-based procedures. Implant-based procedures does not require harvesting of any tissues from other parts of the body. Its main advantage is that it's quick and does not even require you to have any spare tissues. Its main disadvantage is that the implant may not be as natural looking as your own tissue when compared to the flap procedures, and that further revisions might be required later down the road as your body shape changes, as well as if the implant hardens over time as a result of capsular contracture. Finally, there is an emerging procedure known as fat grafting. Fat grafting involves liposuction for fat cells from other parts of the body and transferring those purified fat cells to the breast for reconstruction. It can be used as a supplementary procedure to flap procedures or implant-based procedures so that the appearance is more natural and to provide more padding. It can also be used as a standalone procedure for breast reconstruction. The answer is yes. As with the removal of any organ, there will be a loss of sensation for mastectomy done without reconstruction. Most women are not bothered by this, as most learn to cope with this after a period of time. However, the loss of sensation following mastectomy is very disturbing for some women. For these women, we would offer a mastectomy with a total flap-based reconstruction. During the procedure, the chest wall sensory nerves can be reattached to the flap in order for a regain of the sensation of the breast after the reconstruction. Oncoplastic breast surgery aims to address this issue. There will be cases where large excisions are required in order to safely clear the cancer. This then results in the treated breast looking deformed, different, and smaller than the other breast. Oncoplastic techniques aim to remove the cancer with clear, cancer-free margins and reconstruct that defect in order to avoid the deformity. And in suitable cases, the opposite breast may even be lifted, reduced, in order to match the treated breast. It's a bonus for some women who prefer this approach versus that of a mastectomy and a total reconstruction, which is actually a more complex procedure. Axillary web syndrome or cording is the formation of frequently painful fibrous bands that is encountered following axillary surgery. The patients frequently complain about pain in the underarm and a thickened cord that may extend from the armpit all the way down to the arm and the forearm, and even leading up to the hand. This frequently limits movement. It is a common inflammatory side effect and can be avoided through early mobilization, exercises, massage, and physiotherapy. That's all I have for you today. If you have any further questions, do share with us at BCF. Remember, surgery is probably one of the most important decisions you will make with regard to breast cancer treatment. Make a wise choice, think through your options, but don't take too long.